Thank you so much for being with us this morning. This is a departure from the way that we usually do these things. Today, we wanted to be certain that we were operating on the issues that the community has identified are most important to us. So you will see that we'll be having some activities down here. We'll be going to the second floor. We'll be returning. We're working you today, and you'll get your steps at the same time. Okay? So I am Dr. Pam Straker. I'm the Director of Operations for Brooklyn Health Disparities Center. Brooklyn Health Disparities Center has had the pleasure of really hosting and kind of being responsible for transports symposiums. This is our 8th year of doing a symposium. So I think we deserve a hand. Okay, so today we're gathering under the unifying theme, Addressing Social Determinants of Health, Building Healthier Communities Together. And this theme reflects our shared commitment and responsibility to address the fundamental issues that impact the health and well-being of our communities, particularly in housing, food insecurity, and mental health. Our symposium is unique because it doesn't just discuss the challenges. It is a platform for real-world solutions fostered through the collaboration of healthcare professionals, researchers, public advocates, and our community-based organizations that are really the heartbeat of our local responses. How many people here are from community-based organizations? Thank you so much. I want to let you know that this year, we actually had our community-based organizations engaged in planning this conference. And believe me, for them and for us, that was no easy challenge. One of the things you should know is that Brooklyn Health Disparities Center was founded originally to bring together both the academic, it's actually 3 aspects, the academic, the community, and to be certain that we were giving to the world what our communities needed, all right? So we were actually a combination of Arthur Ashe Institute, and you'll hear something from Faven Araya, who is involved with Arthur Ashe, but Arthur Ashe is actually headed by Marilyn Frazier, who we hope will be able to join us later. But the Institute gave us the community's response, or a statement of the community's needs, and that was part of what Brooklyn Health Disparities was about. It also was, of course, it included SUNY Downstate, and we needed that because the people here from Community Downstate were engaged in trying to address not only the health, but also the social needs of our communities. And finally, we had the Brooklyn Borough President's Office, which really helped us to engage the politicians and to be on top of what was going on that was affecting our communities. So it was a 3-pronged approach, which we've attempted to continue. We feel that we wanted more emphasis from our community-based organizations, and so that's part of why you're here today. But before I continue, I want to make certain that you know that the hard work that you're seeing here today is really conducted by our PIs. They're in the room. I'm looking around. So Dr. Marcus Lambert, Dr. Moro Salafu, and I'm looking for Dr. Carla Booton Foster, and of course, we have these critically important leaders, one of whom is Dr. Marlene Camacho Rivera. And I don't see Mohammed Boujadir, but he is also one of the leaders of transport. So just to continue, today's program is going to include welcoming. I've done a part of that, but you will have some other people who are providing welcomes. I'm not ready yet, Calvin, but we will have the video from our president, the president of SUNY Downstate Medical Center, Health Sciences University. You all know how old I am if I'm still talking about SUNY Downstate Medical Center. We will also have the deputy borough president. I'll let her speak on her own behalf. We will have Alicia Goodrich, who is our assistant vice president of government and community relations. I always read that so I don't make any errors. And each of these folks will give us a very brief statement about their feelings about the importance of this day. Following that, we're going to have Dr. Camacho Rivera explain to us what social determinants of health really are about, and she will give us some sense of how we're going to move from identifying what the problems are to some actionable steps that can be taken in each area. And we thought this was going to be pretty important because in our current state of times, there's a fear about really taking some steps. Not only is there fear, but there's a fear that we don't even know what steps we can take to improve things. So we felt that this would be an important thing to do, to think about how we can move out of the paralysis we may feel when confronted with the many issues we're confronting now. I am going to gradually move away from this podium, and I'm going to ask for Faven Araya to come forward and to introduce, actually, the CBOs who will be working with you in the breakout sessions, which are going to happen on the second floor, but you'll get all of that information. After Faven, you will hear from Lakia Maxwell. Lakia Maxwell is actually the wheel that makes us turn. Without her, we could get nothing done, and I mean that. So, Lakia is hiding in the back, but she'll be up here soon. I also want to bring special greetings to Edeline Mitten, who is the CME director and who is outside signing you in. She's responsible for these tags, and we should all treat them very nicely because they put some work into that. She's also responsible for making certain that those people who may have applied for credit receive it. I want to recognize our team of people who are taking pictures, recording us, et cetera, because as you know, without that, we really don't get too far these days. So we have to be on social media and all of those things that didn't exist when I started out. You notice how I'm referring to that often at this point. You know, time has a very interesting way of changing things. And so we're making certain that we stay with the times. Even as we move on, we are trying to make certain that anybody who follows us knows what we've been about. So, as I transition, I am looking for Faven. I think I saw her in the back. Okay. But I am going to, right now, introduce the video. So Calvin will play the video, and then the various people who are providing welcome will come to the front.
Hello and welcome to the 8th Annual Transport Symposium. I am honored to join you for this significant gathering that underscores the power of collaboration in addressing health inequities, particularly those affecting our communities here in Brooklyn. At SUNY Downstate, we recognize that health extends beyond the confines of hospitals and clinics. It is profoundly influenced by the environments in which our people live, work, and grow. Yet many individuals continue to face significant barriers to stable housing, mental health support, and food security, fundamental social determinants of health. These challenges perpetuate disparities that compromise well-being and place additional strains on public health resources. This symposium serves as more than just a forum for discussion. It is a call to action. It provides a unique opportunity for healthcare professionals, researchers, and public health advocates and community-based organizations to collaborate, share knowledge, and implement solutions that can affect real change. So as you engage in today's sessions, I encourage you to explore ways to bridge the gaps between healthcare and community-based solutions. Consider how we can integrate housing initiatives into healthcare, strengthen mental health support networks, and ensure that food security is recognized as a core component of health. Importantly, let us amplify the voices of our community-based organizations, the leaders working tirelessly to address these challenges. Their insights are invaluable in shaping actionable, sustainable, and transformative solutions. I thank you and acknowledge all the individuals whose leadership and dedication have been instrumental in advancing our mission. I also thank our community partners and all participants for your dedication to this critical work. We can empower communities, improve health outcomes, and create lasting change. Let's make the most of this symposium and move forward with ideas, partnerships, and concrete steps for progress. Thank you.
What you'll notice is that everybody's credentials are in your online program. How many people have accessed the online program? Aha. Please know that we're not going to cut any trees down today. Everything about people is online. However, this is, well, she's not a doctor, but we call her our doctor. Dr. Alicia Goodrich, introduce her.
Trying to start trouble.
I am.
Oh, Dr. Straker's always trying to start trouble. I've been running from that calling, but I ended up in a hospital, so who knows what will happen in the next couple of years. Good morning, everyone. That side was good. This side was a little tired. Good morning, everyone. Thank you. I need that energy. Welcome to the Transport Symposium. This is my third. I've made 3 years here, and this was the first event I ever spoke at. And those 3 people right there at that table, the PIs, were the ones saying, oh, she gets it, the nods. And then I ended up having great conversations with everyone. I want to thank Dr. Salafu, Dr. Straker. You know, we don't talk every day, but you are my, the good team that I need in the background. You never know what you're going to need from folks. And coming in a new place with a whole new set of ideas, you wonder if you get it. And I think I found my tribe. And the Transport Symposium was like confirmation. So I was a little confused when I got, I was like, how am I going to work this? Because I came from government, and before that, corporate, and in the community. So it is so exciting to hear that we have CBOs in the house, because you are the breath and life. You do the work that we can't do in any aspect. Working in elected official office, it was the CBOs that lent that hand when someone was coming to us about rent, a health issue, and we're only an elected official office. There's so much we can do. So without the CBOs, nothing can really happen to the extent that we can do without getting in trouble. We won't continue that conversation, but it works hand in hand. So there's an importance for us to stick together, stay together, work together. And one of my goals is to understand all the CBOs that are working with us so we can link arms together and really build out what needs to be done in the community, because as a hospital, we can't do it all either. You know, the biggest CBO out there is the church. they're very important as well. So I've been finding ways to bring them in because folks go to the hospital or to the church when they're not well in any aspect in life. And I will not go more into that, but we have a double impact because our deputy president, borough president, I almost got in trouble with that one, woo, is a reverend and an elected, appointed official. Let me get that right as well. So I wanted to just pass the mic over to the awesome, and she's been here a couple of times this year alone, so I think she's trying to get some residency here. Hint, hint. Reverend Dr. Kim Counsel, our awesome deputy borough president.
Good morning, everyone. Good morning, Brooklyn.
Good morning.
So glad to be here. I'm Reverend Kim Counsel, Deputy Borough President. I bring greetings on behalf of our Borough President, the Honorable Antonio Reynoso. Very special thank you to Dr. Straker, to Dr. Lambert, to Alicia, to the entire team that worked so hard to put this together. I think this was the first, when I became the deputy in 2023, they had me do a video in the office. I'm sure I stumbled over that multiple times. I hope Joe edited it nice and that I sounded like I knew what I was talking about. And then last year, I actually got to come in person. And this year, we actually had a conversation before we got here. And so I've been thinking, like, all morning, like 15 minutes to a preacher, that's a significant amount of time. We can do a whole lot there, but I promise I will not be that long. So I was thinking, how do you transform insight into action? How do you take the research and turn that into resources? That is the age-old challenge that we've been dealing with, and I'm so thankful to SUNY Downstate and to the Brooklyn Health Disparities Center and to each and every one of you, these community-based organizations that work on the ground each and every day. We often grapple at Borough Hall on what is the best way to use our resources to create impact. And each administration has a different way in which they try to do this. And so I'm so excited to work with the BP, Antonio Reynoso, who works to lead through a lens of equity. The first thing that he did when he came in was commission a comprehensive plan for the borough of Brooklyn, where we looked at the data, and instead of just throwing money at the wall, we wanted to look at what was happening all across the borough of Brooklyn. And it's not unlike what my predecessor, Yvonne Graham, did when she commissioned this research to look at the health disparities all across the borough. Because Brooklyn, in and of itself, it would be probably the fourth largest city in the state of New York. We've got 2.7 million people with 2.7 million problems. And so how do we take this academic research that we've put together and combine it with the people who are on the ground each and every day looking at the challenges that our communities face? This is how we're going to do it. You guys are the ones that are going to, put on your thinking caps today and each and every day and work together in order to ensure that the people in the borough who need the most get what they need. And the BP always says that the people or the communities that have the least resources don't need more policing, they need more resources. And I'm coming to you as someone who worked at a law firm for 25 years, but part-time ran my church's nonprofit in Crown Heights, where we saw that they shut down St. Mary's Hospital in a community that was at the top of every negative health indicator. And so what did our church do? We opened up a clinic. We opened up a clinic because we had a doctor that was a member of our congregation. And so she brought in pediatricians, and she brought in general practitioners, and she brought in OBGYNs in order to begin to try to meet the needs of our local community. And we often compartmentalize how we deal with the stressors of life, because we know that you need housing. We know that if you don't have housing, or if you're stressing to pay your mortgage or your rent, then you're going to have a hard time putting food on the table. And if you are stressing over your housing and you're stressing over how you put food on the table, then that's going to lead to some mental health issues. And so today, I hope that we can take the Brooklyn Health Disparities organization, we can take your insight, and we can take the government people who Alicia will make sure know what needs to happen, and tie our ropes together. Thank you so much, and God bless.
Thank you. I now have the pleasure of introducing Dr. Camacho Rivera. She is not only, actually, did I leave something out? No. Dr. Camacho Rivera is not only the Assistant Dean for Student Affairs and Success and an Assistant Professor in the Department of Community Health Sciences at SUNY Downstate School of Public Health. You do realize why I had to read that? Okay. She is also a graduate of the Transport Postdoctoral Fellow Scholar Program and currently leads training programming for our scholars and for our CBOs. Thank you.
All right. Such a pleasure to be here and in community with you all. I know that these are some challenging times that a lot of us are facing, but I'm heartwarmed, I'm motivated, and I am hopeful to see so many people here focused and committed to the work. And so moving forward today with some optimism and some clarity and some intention to be able to continue to do some good work here locally. I think I was asked to talk about sort of helping to understand social determinants because that's an easy conversation to have. We all know what social determinants are. We all understand what social determinants are, even if we don't necessarily understand or can't define sort of the academic jargon that labeled it and deemed it social determinants of health. I am a social epidemiologist by training, but I think the greatest education that I ever got around social determinants of health was being born and raised in East New York, Brooklyn. And so I got a bachelor's, a master's, and a doctorate in social determinants of health long before an academic institution ever gave me a degree deeming it so. But I want to just set the stage and be explicit about what we're talking about. So we're talking about social determinants, and so from an academic standpoint, we often define social determinants as conditions and environments where we're born, where we live, where we grow, where we work, where we age, that influence a variety of different health outcomes. And so I want to leave us maybe with some five points to kind of set the stage for the work that we're going to continue to do today. First point I want to highlight is that social determinants of health are holistic. And so oftentimes we think about, you've seen different sort of diagrams and figures around social determinants of health kind of being broken into 5 different domains. And the domains that we think about from an academic standpoint are around education, access, and quality, healthcare access and quality, neighborhood and built environment, the social and community context, and economic stability. But we all know that those are interrelated. We can certainly see that from the priorities that we've established today with respect to thinking about how housing security, housing stability, housing quality, and food security influence our mental health. And our mental health and well-being help us to ensure that we are economically stable and socially contributing as well. And so the first point is that social determinants are holistic and interrelated. I know that, again, in the academy, we sort of labeled them as social determinants of health. I don't love the phrase determinants. I often think of those as being a little bit predetermined and a little fatalistic. And so I know that at least in academic environments, we've tried to move from social determinants to thinking about social drivers of health. I think that drivers still underscores the point that these are fundamental conditions and fundamental resources and fundamental issues that we're studying. But drivers also points to the fact that we can change course and that they're modifiable. And so just thinking about the fact that our social drivers of health are intentional. They're based on intentional decisions, political decisions, public-private investments, but they are modifiable. And so I really want us to lean into the fact that we have individual agency, that we have collective agency, and we can do something locally and even on a broader scale to be able to change course. The third thing I wanted to point out is that social determinants are multi-level. And so some of the issues that we're going to be talking about impact us as individuals in very deep and meaningful ways, but we can think about how they influence our interrelationships that we have with individuals, how they influence our communities on a broader scale, the role of organizations, especially healthcare organizations, for example, like SUNY Downstate, in being able to address social drivers of health, and of course, thinking about societal influences, especially through policies and programs and resources. The fourth point that I want to highlight, and this was really one of the motivating factors for me to pursue a lifelong career in public health, specifically health equity, is I want us to be able to continue to move away from deficits-based approaches towards just describing problems within our communities and seeking to understand problems in our communities. I think in spite of our best intentions, we oftentimes reinforce deficit-based approaches, just thinking only about what's wrong, not recognizing the strengths that we have within our communities, the assets that we have within our communities. And so really leaning into those assets that we have while recognizing that, yes, there are more resources that can always be allocated to continue to bolster those assets, but also address the challenges that we have. And then the fifth point that I wanted to talk about and highlight was, again, leading with community and centering community in everything that we're doing. Inherently, we always have community engagement as part of our core mission within this symposium, and of course in the work that we're doing here at SUNY Downstate. But I want to think about, community engagement exists on a continuum. And so if you think about the least sort of forms of community involvement, that involves outreach and sort of consultation with community-based organizations and individuals with lived experience. But I want us to continue to move forward through involvement, through collaboration, all the way to shared leadership, which is what we strive to practice here with this symposium today. It's what we strive to practice every day, and I think the Brooklyn Health Disparities Center is a great example of that, thinking about the shared leadership between SUNY Downstate and Arthur Ashe and the Brooklyn Borough President's Office. And so as we continue to move from just thinking about outreach to shared leadership, we not only increase community involvement, but we increase trust. We support trust and trustworthiness of individuals and institutions doing this work. We enhance communication, and we also bolster our impact. And so just want to leave us with the fact that social determinants are holistic, they're multi-level, they're dynamic, they're modifiable, and they're actionable. And so I tried to find one slide that sort of gave us all of these different concepts and thinking about, again, how we move from just understanding into action. And this was developed by the CDC. This is nice. I spent some time looking. It's probably the best that I could think about. So there are specific tangible strategies that you could find on this image. I want to start at the top, creating and enhancing our partnerships, really leaning into the community and the relationships that we have built and we continue to build and sustain. Thinking again and having clarity around social determinants and having clear objectives and goals and thinking about how we measure impact just beyond the academy, but really thinking about community impact and real world impact. Of course, we talked about building community capacity through resources and recognizing assets, not just focusing on challenges. Recognizing that one-size-fits-all approaches never did anybody good. One-size-fits-all fits no one. And so recognizing that the strategies that we're developing today really need to be tailored to our community, recognizing that our communities are diverse. It's one of the most powerful things about Brooklyn. You have 2.7 million people and 2.7 million people with very different lived experiences and stories to be told. And of course, moving to action, recognizing that we need to share the work that we're doing. We need to document our experiences. These are our stories to tell, and we should be the ones telling them, not letting anyone else dictate that. And of course, just moving forward with sustaining our momentum. And so I leave this as a roadmap sort of for us to be able to think about, but I really want us to develop our own roadmap and continue to create solutions that are specific to our communities here in Brooklyn. So thank you.
And now it gives me great pleasure to introduce Faven Araya. I almost called her doctor. I'll tell you why in a minute. She is the Director of Community Engagement and Health Equity Research at Arthur Ashe Institute for Urban Health. And one of the reasons that I almost called her a doctor, Faven, where are you? Come on up, come on up. Is that Faven is involved in a doctoral program, and we soon will be calling her officially doctor. And before you start talking, Lakia is also involved in the doctoral program, and we soon will be calling her doctor. Now, you guys may think that this is mentorship, but what they know is that I wear very pointy shoes. Now, I haven't applied them to Faven, but Lakia will tell you I have applied them to her. We believe in encouraging people. That means the people in this room, that means the people who come to the mic, anybody who is interested in pursuing a life in public health, we're here to encourage you. So thank you, Faven, and do your thing.
Thank you, everyone. Before I get started, I do want to introduce Dr. Marilyn Frazier is here.
Ooh.
So I would like to have her come up. Dr. Marilyn Frazier is the CEO of the Arthur Ashe Institute of Health.
Great. Thanks, Faven. I'd just like to thank everyone for coming out today. This is just a great gathering, and I know we can have a great time and to just hear about what community-based organizations are doing, all the hard work that is being done, oftentimes behind the scenes. And so today we'll get a chance to hear about some of those things and think about strategies and so forth. So without further ado, I'll turn it back over to Faven so I don't steal all the things that she needs to talk about. But thank you so much.
Thank you.
Thank you, Dr. Frazier. So one of the things that I wanted to share is that the Institute, I'm going to move this, that the Institute also serves as the lead agency of a network of community-based organizations called Communities Together for Health Equity. It's a diverse group of CBOs that provide social determinants of health across all of New York City. We're smaller, grassroots community-based organizations, which by criteria means that we're 501c3, we have budgets of less than $5 million, and generally are non-Medicaid billing. And our work is centered around addressing the social determinants of health, and we know that community-based organizations have a long history of doing this work. And so back in 2022 and 23, CTHE launched a community needs assessment to understand the on-the-ground experiences of the community that it served. And one of the ways that we did that is through a mixed method approach. So oftentimes needs assessments are grounded in reports and data, but we wanted to ensure that community voices were reflected and actually informed the needs assessment process. So we worked with a cohort of 10 CBOs that represent the various social determinants of health, that represent all 5 boroughs, and they led the co-planning and design, development, and implementation and evaluation of a needs assessment citywide. And so the conversations that we're having today around food, housing, and mental health are informed by that process, right? We don't want to have a siloed or arbitrary process that says we're going to focus on food or mental health, but we wanted to ensure that the process was informed by the community. And so with that, there's also an understanding that community-based organizations have a really nuanced understanding of the communities that they serve. And so that needs assessment reflected not just food, housing, and mental health, but what does food look like in Arab American communities? What does food look like in Afro-Caribbean communities? What does mental health look like when you're coming from a traditional cultural background? What does housing look like when you're living in a multi-generational household? And so those nuances were captured in that needs assessment. And the CBOs that we are going to hear from today are going to talk about their expertise and experience serving the community with those nuances in mind. And so without further ado, I want to introduce a few of our community-based organizations who are going to highlight the work that they do to address the social determinants of health. And I'm going to start with Grace Ruiz, who is an assistant program director at CAMBA, who's going to focus on housing.
Thank you, Faven. Thank you, everyone. Good morning. How's everybody doing? When I was first approached about going here to SUNY Downstate, this is actually a full circle moment. I'm going to have a little personal story here. My sister was in the Arthur Ashe Urban Health Science Academy in high school. And 2001 till 2003, and they made her who she is today. So shout out to you all. She is now I can't get this wrong or I will be in trouble. She is the chief of biothreat for DOH-MH, and her name is Dr. Victoria Ruiz. And when I told her about this, I was like, our work is combined, full circle right now. So thank you all for that. So back to my work. My name is Grace Ruiz. I manage the outreach and marketing for the home-based program at CAMBA. CAMBA serves more than 64,000 individuals. You might see around here we have shelters, affordable housing, the UCAN van. I work for the home-based program, and we provide holistic services to struggling New Yorkers. Born and raised New Yorker, born in the Lower East Side, raised in Brooklyn, and we want the communities to be stabilized, self-sufficient, and we have programs and initiatives to help each other and teach each other in their essential moments in their lives, or in ways that if they're struggling, we want them to know that we're here. So the home-based program that I will be discussing later today in the breakout rooms, and just regarding housing, our goal is to prevent people from going to the shelter. We want the trauma of homelessness, it directly affects your health and as well. And in many occasions, the clients that I meet, it's like, health, housing, what do I choose? And it's like, yeah, no, it's a question that's like, why do we have to question that? So we're here to provide personalized assistance and approach for people at risk that might be facing homelessness, and we want them to remain stably housed in the communities they serve and in the people that they meet, because I know that the community that I've grown up in Brooklyn definitely tremendously helped me in the work that I do, and it's only my right to give that back too. So thank you, and looking forward to speaking with you guys later. And I'm going to then introduce to the next CBO. Fabian, I'll direct it back to you, but I'll see you guys later, and thank you so much for having me.
Thank you, Grace. Our next CBO partner is Dorella Walters, who's the Chief Business Development Officer at God's Love We Deliver, addressing food insecurity.
Hi, everyone. Thanks so much, Fabian. So happy to be here, everyone. I don't know if you're aware. So God's Love We Deliver is going to be celebrating its 40th anniversary in May. Thank you. We started as a direct response to the HIV/AIDS pandemic, and then in 2001, we decided to expand to serve other serious illnesses. So right now, we're serving over 200 serious illnesses, and we have found that 90% of our population has 4 or more comorbidities that they're dealing with. All of them have some type of physical difficulty shopping and cooking meals for themselves. So we see ourselves as part of a spectrum, and that's what you're going to hear about later. We call it the Food is Medicine spectrum. There is a coalition called the Food is Medicine Coalition, which consists of similar organizations across the country. We do recognize that there are different types of food interventions or solutions, let's call them that. Think of SNAP benefits, think of congregate meal programs, think of social adult day programs that provide both food and the support that individuals might need in terms of socialization. That said, sometimes individuals, as they may be experiencing a serious illness and have struggles, let's say, taking care of themselves and their children and maybe caregivers, that's where our program comes in. If someone is, let's say, 30 years old, dealing with a cancer diagnosis, is going to be down for the count, experiencing chemotherapy and radiation, maybe they're not eligible for SNAP benefits, maybe they're not able to physically go to a food bank. So that's where we come in to be able to deliver to the home, and we recognized that we needed to feed the whole family because we found that our primary clients were giving their food away to their loved ones. That said, medically tailored meals is what we provide, and we recognize that having a dietitian, a registered dietitian nutritionist, be part of the education of both the individual experiencing the diagnosis and the family is what's going to help them after they come out of that moment of sickness, if that is the trajectory of their health, so that then they're able to be whatever, address their food needs from a nutritional standpoint as they leave our program. However, we do have some individuals, let's say with dementia or Alzheimer's, that will stay on long term. But the goal is to make sure that those services are done in a culturally appropriate way, recognizing that we can modify the meals based on texture if needed, allergies if needed, and then, of course, cultural nuances. So we're super excited to be here with you all today. I am, and I'm looking forward to talking to everybody later. Thanks.
Thank you, Dorella. And last but not least, I'm going to have Melissa Elliott, who's the founder and owner of Agape Family Therapy and Coaching, talking about mental health and wellness.
Good morning, everyone. It is a pleasure to be here with you all today, to the organizers, to Dr. Straker, for thinking about Agape Family Therapy and Coaching, to come to really talk about the issues in our community. As a Brooklyn bred and Barbadian raised person, living in New Jersey now, it's been quite an experience because my heart is in Brooklyn. I'm a licensed clinical social worker. I'm a certified professional coach. I'm an adjunct professor, and I am on the board of the Association for Nonprofit Specialists. And with all of that, I'm a mom and a wife. And what we see in the services that we provide at Agape through individual, family, couples, group counseling, as well as coaching, parent coaching, life and leadership coaching, and training on self-care for the helping professionals, and trauma-informed care and culturally responsive care, what we see is that all of the systems that I've just talked about, from organizations doing this work to individuals in the communities dealing with their families, their loved ones, their moms, their dads, whether you're sandwiched in the middle, taking care of being a caregiver, or you've just given a baby and you're experiencing some PMAD symptoms, perinatal, postnatal, anxiety and depressive symptoms. We serve it all. And we're noticing that it's more than just the individual, but it's we're looking at the holistic connection to our families and our communities. And what that looks like is, what is their financial health? What is their housing stability? What does their environment look like? What does their vocational and educational aspirations or barriers to that look like? What are those health issues that they're seeing in their family members and they're stressed out about? What does childcare look like? Well, access to childcare, the affordability of childcare. All of those things contribute to the mental health issues that our families, our individuals are going through. And so we like to take a holistic approach. We like to primarily, we've been working in PMADS, which is maternal mental health, and we also have realized the research says that fathers are experiencing mental health issues related to just having to change their life, having to look and be responsible for that financial responsibility of their families. They're experiencing anxiety and depression. So what does that support look like within that family? How are we talking about that? How are we giving access to individuals who may need supplies for their babies, doulas, access to doulas, support when that child comes home? How are we wrapping around that particular family? And so I'm excited to talk with you all later on in the breakout rooms to look to get to those solutions, those barbershops, those beauty salons, those churches. How can we campaign and rally around where our people spend the majority of time to give them the information, most importantly, to destigmatize access to mental health, to give them the information and education around medical support, mental health support, financial support, spiritual support. I'm looking forward to that, so I'll see you later. Thank you.
Okay, and now we're getting to the meat of our program. Thank you so much. I have to tell you, Fabian is one of my favorites, so thank you, Fabian. I'd like to bring Lakia Maxwell forward, and she is going to give us the logistics for the day. Her official title is Transport Program Manager, Project Administrative Officer for Brooklyn Health Disparities Center, and more.
Good morning, everyone. Thank you for the introduction, Dr. Straker. So at this time, we are going to transition upstairs to our breakout sessions. Our breakout sessions are in the same building. The elevator is right here near security guard. It's on the second floor. There are labels on the door of each classroom to let you know which breakout session that classroom will hold. I'll also let you know the details. Classroom 2B is housing. Classroom 2C is food insecurity, and Classroom 2E is mental health. I just have a few discussion ground rules because we're all going to be sharing our ideas, and we're going to have these meaningful discussions surrounded about social determinants of health within our community. I ask that everyone respect everyone's voices. We want to make sure this is a safe space so everyone can share their ideas, and we want to stay focused on that. And then we want to encourage diverse perspectives. So we want to hear from everyone. We want you to be able to speak and say how you feel during these breakout sessions. And then we also want to ensure confidentiality. So we want to keep what we discuss within this room and within the classrooms upstairs to make sure that everyone feels comfortable. After the breakout sessions, we will return downstairs for lunch. Lunch should begin at 12. And right after lunch, we will go into our actionable steps. So downstairs, we're going to transition back downstairs. And here, we're just going to talk a little bit further about the actionable steps surrounding housing, food insecurity, and mental health. At that time, my co-leaders, which are our transport scholars and students from all of our programs, they will be helping us. Thank you so much. The co-leaders will help us to collect and gather the data. So you'll see them within the classrooms working on their computers. They will just, jot down key points from each of the breakout sessions. They will be doing it simultaneously. So we have a few students in each classroom who will gather that data. Once that data is gathered, at the end, for the actionable steps section, I will then come back and present what we all have worked on over the course of the symposium. So thank you so much, and I look forward to seeing everyone during the breakout sessions. If you need me, I'm around, and I'm here to support everyone. Thank you.
So I just want to come up here before we transition and just remind folks that the purpose of the breakout sessions and the convening, is that oftentimes when we're talking about social determinants of health, the work is happening in silos. You have academic institutions, you have government institutions, you have community-based organizations who are doing the work on the ground. But there's oftentimes not a lot of space and opportunity to bring diverse sectors together to be able to identify the problems that we're being faced with in the different sectors, talk about best practices, and then identify actionable next steps. And so this is a really unique opportunity where we get to do that. And so we want to we've created a facilitation guide and questions to help stimulate conversations so that when we come back, we can talk about what actionable steps we've identified. So just wanted to set that tone. Thank you, everyone.